It's not about the lead in the tampons. It's not about the levels. It's not about the arsenic. It's not even about the study at all. It is about the constant playing in our fucking faces with the double standards and treating women's most basic fundamental health like a nuisance that medical science should just shove the first incomplete, unresearched, thoughtless solution at. And then acting like we are crazy for wondering if there's maybe a better solution than sticking bleached, arsenic-soaked cotton inside of the most divinely absorbent center of the human body that y'all didn't even bother to test with real blood until about 100 years after you gave it to us. It is about women accounting for 80% of autoimmune disorders, but less than half of the autoimmune research. It is about still not knowing the long-term effects of artificial hormones, despite them being a good solution for some. Because we don't get research, we don't get studies, we get a best guess, finger guns, a shrug, and a good luck with that. And we are tired.
Medical misogyny is the systemic bias, discrimination, and neglect experienced by women within healthcare systems due to gendered prejudices. It reflects a historical and ongoing pattern of mostly men dismissing or minimizing women's health concerns, symptoms, and experiences, often resulting in inadequate care and poorer health outcomes. This happens all over the world today. Here are some women's experiences.
More than a dozen physicians repeatedly told me that my ultrasounds looked normal, to just take pain medicine, to get more rest, or that my period symptoms were typical for a woman, making me feel like a true drama queen. This attitude toward me persisted for years, to the point that I began to question my own sanity. Imagine waking up tomorrow morning, feeling inexplicable pain that worsens, and the cause won't be diagnosed until 2033. The average wait time for a diagnosis of endometriosis is 10 years. That is our reality, and that needs to change.
Years of not being able to swallow, I finally have a diagnosis. Jackhammer esophagus. Metal AF is a serious and progressive condition that there aren't really good treatments for. Its technical name is hypercontractile esophagus. My esophagus doesn't know its own strength and squeezes 4 times stronger than it should on an average swallow. Which is why sometimes when I'm eating, I get these episodes where I swallow and the food feels like it gets stuck and it's incredibly painful, and I sit there and my face turns bright red and tears stream from my eyes, and everyone I'm with is go, oh my god, what can I do to help you? And literally nothing, just leave me alone. And then, it eventually goes down. But I've lost a bunch of weight and started to avoid food. But I'm just so frustrated that it took the VA that long for a simple diagnosis. When I posted these results of my swallow study, someone on TikTok told me something was wrong, before the VA doctors ever did.
This is a classic instance of medical misogyny. Dismissal of symptoms, gender bias in research and treatment, stereotyping and assumptions, delayed or inadequate diagnosis. If this was a man making all these complaints, doctors would have taken it way more seriously. Just look at the things this young woman was told and how this she was overprescribed with medication that must have negatively impacted her health and affected her day-to-day life.
That's not fair. That's not fair! That is not fair!
clitoris tore during childbirth. They didn't even try to repair it. My clitoris was damaged in a biopsy. They told me I needed to make sure I didn't have cancer. I didn't have cancer. My labia minora tore during a rape, so I had to get a repair. My doctor damaged my clitoris. My clitoris got injured in a skiing accident. They didn't even try to fix it. I was born intersex. When they reduced my clitoris, they didn't even try to spare the nerves. I lost clitoral sensation as a kid. They did a surgery on my clitoris because I had some kind of skin condition. I lost clitoral sensation in a labiaplasty. They told me it would improve my sexual function. My clitoris was removed because I had vulvar cancer. I don't know if they really needed to do that. I have no feeling down there after a playground accident. I don't know if they did their best to fix it. I don't know if it even mattered to them. I was just a kid. My clitoris was removed for cultural reasons.
On average, women are diagnosed with a condition about 2.5 to 7.5 years later than men. We're also more likely to be misdiagnosed or overprescribed medications. And now women account for about 80% of those with autoimmune conditions and about 70% of those with chronic pain. But what's interesting about this chronic pain thing is that 80% of the studies done on chronic pain are done on men and male mice. And this just might be a coincidence, but women weren't included in research studies until about 1997. And one of the reasons is that our menstrual cycle, so the hormones estrogen and progesterone that fluctuate throughout the menstrual cycle, will cause too many variables in research studies. So they just kind of shoved us out of those research studies. And now they look at us as just like small men. But maybe, just maybe, it might be a coincidence, but maybe the menstrual cycle plays a much bigger role in women's health and how we should be treated than our healthcare system wants us to believe. But maybe this is also why we get misdiagnosed, not diagnosed until much later, or overprescribed medications. Maybe it's because our cycles actually do play a role in our health, and maybe that should be taken into consideration when it comes to healthcare. But
Female patients are often not taken proper care of and are sometimes neglected in hospitals, similar to a situation that happened with this next woman.
Every so often I will happily answer this. I have 20 canes because my left leg is paralysed from the knee down. And no, I wasn't drunk and I wasn't wearing heels and I wasn't playing football. I had a brain disease. But no, the brain disease didn't paralyse my leg. The brain disease was misdiagnosed for 3 months. I was locked in a psychiatric ward. At the end of those 3 months, they gave me ECT, which is shock therapy, which triggered seizures in my brain to try and reset this misdiagnosed brain disease. The seizures ended up with me left unattended, seizing, falling out of my bed and landing on an open radiator pipe with no cage on it that was next to the bed. It was really hot. I was catatonic, couldn't feel my own body because of my brain disease, so the pipe burnt all the way through my sciatic nerve, which ultimately paralysed permanently my leg, and then I had to learn life with a brain injury, couldn't speak, etc, etc, etc.
One of the reasons why female representation in medicine, engineering and STEM in general is so important is because of the things that are about to be talked about in this next clip. We shouldn't waste time expecting men to care for or put in the work to improve women's well-being. We have to do that ourselves.
Everybody should know is that test dummies were designed around men. Women were 47% more likely to get hurt in an accident because their center of gravity wasn't accommodated for. Fun fact, the recent solution for that was only making them a little bit smaller. Artificial hearts, designed around men. Women are more likely to suffer from complications or die when they get them implanted. Your AI, if you're a woman, less likely to understand you. Often AI is processed around male voices. Clinical trials are typically designed around men, which means dosage of medicines are also designed around men. One of my favorite books gave me most of the citations that I listed above. It's called Invisible Bias, and it talks about how we need more women in science and in design so that these products aren't created for men by men.
Here's what really just gets me about this whole period product situation. If you don't know what I'm talking about, basically it just came out that they've been testing period products with water instead of with anything close to the consistency and viscosity of blood. It's like, tell me a man is in charge without telling me a man is in charge. Because no woman, no person who has ever had a period would ever think, I'm going to test this with water because that's going to give me an accurate representation of how absorbent it is of period blood. Like, it's so stupid. It doesn't make any sense. And you know what's so annoying is the amount of comments underneath the original video that I posted that are like, gosh, I've always felt so insecure when I wear pads or tampons. Like, my flow must be different from other people's because it doesn't work for me, and I feel like I have to be changing it every hour. And so now I feel like there's something wrong with me because these products aren't working for me the way that they're supposed to and the way that they're advertised to. And I have absolutely felt that way too. I've always felt like, why doesn't this product work for me like it's supposed to be working and how it seems to be working for everyone else? Because we're not talking about how when you wear a pad and it just like pulls up and leaks instead of like absorbing it like it's supposed to. We're not necessarily talking about that all the time. We're insecure about it because it's a taboo topic. They really have just gaslighted us into buying these products that aren't even tested correctly to work in the way that we need them to work. And now we're stuck believing that there's something wrong with us instead of something wrong with the product. It's infuriating.
People constantly talk about and prioritize men's mental health and love to act like no one cares about their mental health. But the irony is that it's women and girls' mental health and mental disorders that are often overlooked and not taken seriously. That video about autism also reminded me of this meme and how men use mental illness to justify their violent acts. I always wonder why so many women choose to get pregnant and not just adopt when they know childbirth is an excruciating and even traumatizing experience, especially when they know how women's health is treated and all the flaws the system has.
Okay, so the last line of the Barbie movie is her standing at a receptionist's desk and she says, "I'm here to see my gynecologist." And I was like, oh, that's funny. And then on social media, I kept seeing posts that were like, oh, Barbie's gonna be a mom, or like she's gonna start trying to get pregnant. And I'm just confused by this. So if this is your reaction, why? Like, I'm so curious. This isn't rhetorical. Like, is the first time that you went to the gynecologist because you were going to try to get pregnant? My experience is so different than that. So I first went to a gynecologist at 15 years old and started trying to get pregnant at 32. So in between those years, I saw gynecologists literally dozens of times. And so I made a list of 10 reasons I went to the gynecologist that had nothing to do with trying to get pregnant. So here we go. My annual exams, including my pap smears, painful periods, painful ovulation, burst cysts, prescriptions for birth control, STI testing, STI treatment, pregnancy tests, HPV monitoring, and getting yeast and bacterial infections. So that's just 10 I could think of off the top of my head. Why was people's first reaction that Barbie was going to try to get pregnant? I'm just super confused.
I think it's mostly because people just aren't educated enough on women's bodies, and even on the basics of our reproductive health. Most people don't know there's so much more to a woman's reproductive health than just sex and pregnancy. This next video explains this further.
People say that sex education should start in kindergarten. This is what they mean. You shouldn't have to wait until adulthood to learn the names of your own body parts. The whole region that people call the vagina is actually called the vulva. Many people I know well into adulthood do not know what the perineum is, what the mons pubis is, and a whole bunch of us were taught pet names to call our genitals, as opposed to just calling them what they're actually called. Those people grow up and think that those parts of their body are shameful, and they're just parts of your body. Also, consent does not just apply for sex. Kids should be learning that you don't touch other people without asking, and that you should never feel entitled to any part of anybody's body. I think we all know tons of adults who don't know that. Imagine if they were just taught in kindergarten.
These next two hilarious satires perfectly sums up how male doctors treat their female patients.
Hey there, I just wanted to let you know that your labs came back normal. So I think maybe you're just acting.
Hi there, what can I help you with? What's going on? Okay, you've got a headache and some palpitations, can't walk. Well, you know, that happens. You're young. Have you eaten today? Only twice? Okay, well, you could probably stand to miss a meal every once in a while. Are you pregnant? No. Are you sure? Are you super sure? You're gay? Okay, are you still sure? Okay, there's a magnet 2 buildings down that will just destroy the baby inside you if you're not telling the truth. No? Okay. I don't believe you. Here, pee in this cup. We get a pregnancy test in here? Yeah, no, that's the only test we need. Yeah. So what you may be experiencing is what we in the medical field call referred pain. And it could be caused by the baby that might be growing inside of you.
Doctor, the test came back negative.
Oh, okay. Well, then you're probably ovulating. Just like a lot of women your age seem to be going through this right now. Also, I see you are on SSRIs. You take Zoloft, okay, for anxiety, depression. Yeah. Mystery solved. I would say this is definitely anxiety related. We'll get you discharged out of here. That'll be $875,000. And don't worry, get you that psych referral. Can I talk to the nurse?
Did you know that women need more sleep than men? There are a few reasons for this, but one of them is that a study out of Loughborough University showed that women need more sleep because we use our brains more. It's the science. Our brains are wired differently and we tend to multitask a lot more. Jim Horn, the director of the UK Sleep Research Centre, says that women tend to do lots more at once, are more flexible, and so they use more of their actual brain than men. Not just this, but lack of sleep presents differently in women versus men. So women usually will experience more severe symptoms like anxiety, depression, irritability, etc. Now, lack of sleep and distress can both affect our hormones negatively as well, which can lead to a whole bunch of other negative symptoms. So it's recommended that women actually get 1 to 2 hours more of sleep each night than men do. Versus the standard 7 to 8 hours, women will likely do better with 8 to 10 hours of sleep. Interesting.
I'm Cindy, and this is why I'm fighting for healthcare equity for women. For years, I lived with my grandmother in a nat flat, an apartment the size of a college dorm in Beijing, China. Most of her life was plagued with extreme poverty, famine, and untreated health issues. Half of her face is paralyzed due to an untreated head injury. Her suffering was never validated by her doctors, and she was not listened to because the world doubts women's pain. My experience living with my grandmother inspired me to pursue academia and health equity. My passion to work with and for marginalized women is driven by my grandmother's resilience. I used to listen to my grandmother talk about how she dreamt of going to school while I massaged her half-paralyzed face, and now I teach her about the anatomy of facial nerves, something I learned in school. I believe reformation in healthcare is on the horizon, and women and girls are at the forefront of it, fighting for themselves, their mothers, grandmothers, and sisters who were and still are told to be silent in their pain. And I am honored to be part of this catalyst for change.
Most women with endo don't get properly diagnosed for a whole decade. I began to realize that I was being penalized because I have a uterus. I have a vagina. That's right, a vagina. A love box, a snatch, a pleasure cave, my private, my punani, my down there. Because you see, if I didn't have a pussy, if I was a man and couldn't get it up, oh, there'd be many drugs, many treatments, and it would be covered by insurance. But for the 200 million women with endometriosis, still nothing. Nothing. Except the pill, when we can get it. Surgery, most insurance doesn't pay for unless you wind up in the ER. And oh yeah, a drug that induces a false menopause. Okay? Real menopause is bad enough. Now, on top of endo, we're supposed to give it to ourselves on purpose? I hope that by the time my daughter is an adult, there is a cure. Or at least accessible treatment that's covered by insurance. So women worldwide don't have to suffer in silence like I and millions and millions and millions of women do.